And welcome to the live session of the Sickle Cell Awareness Month campaign, which is Together We Can. We at Dr. Sickle Cell, we view this as an opportunity to coordinate global, national, and local efforts in overcoming sickle cell disease. So today we are convening this platform to talk about the Nigeria SCD Bill, and we have a host of reactive stakeholders, and they are going to be sharing their views as regards the issues surrounding the SCD Bill. So we have on our list today, we have Sharon Browne-Peter. She is the president of Cells of a Generation. And also we have Ms. Toyin Adesola. She is the founder and executive director of Sickle Advocacy and Management Initiative. Also, we have Dr. Alayo Sopekan. He is the deputy director, NCD, Federal Ministry of Health. So we have Mr. Oluseyi, Oyebisi, the executive director, Nigeria Network of NGOs. They are going to be deliberating and talking more as regards the issues surrounding the SCD Bill, as I said earlier. Before we dive into it, I would like to give recognitions to the host, Dr. Sickle Cell, the organization hosting this, and also our partners, SickleCell Advocacy and Management Initiative, Sickle Life Ghana, African Film Consortium, Cells of a Generation, Fresh Cells Inc., and the World Health Organization for Africa. So we're going to be starting first with Sharon Peters. So the floor is yours.
Okay, I'm so sorry. First of all, I want to apologize. There's a lot of rain in the background. So if you can't hear me, that's why. So good afternoon, everyone. My name is Sharon Browne-Peter. I am the founder of Cells of a Generation Initiative. Thank you so much for putting this together, African Congress on Sickle Cell Disease and the Sickle Cell Advocacy and Management Initiative. I'm honestly very honored to be here to voice my opinion on this bill. So as a quick, just background on who I am, I'm a writer, I'm a media professional, and I'm also a sickle cell warrior. I moved to Nigeria in 2008 from the United Kingdom. My healthcare regimen from both countries, like here and the UK, has been varied in multiple ways, both positive and negative from both countries. But this overall inspired me to start my organization. So I'm the founder and leader of the youth initiative in Abuja called Cells of a Generation Initiative. We're dedicated to sickle cell advocacy, and our current programs include the DD Project, which is public education using storytelling with sensationalized characters like 13-year-old Didi, which is a sickle cell warrior, and They Call Me Warrior, which is a documenting real experiences, advocacy, and development in research and sickle cell disorder. So I have basically done so much research on the current status of government intervention on sickle cell. And on June 15th, 2020, I sent a letter to the Honorable Minister of Health to highlight the need to reevaluate the Nigerian National Sickle Cell Disease Control Program. Is on our websites and everywhere. So the Sickle Cell Bill is an amazing occurrence right now. Not many youth know about the Nigerian intervention in sickle cell. There has been quite a lot going on so far, but this bill can basically put a stamp on everything that we've worked on to this point. It will sickle cell become a major non-communicable disease in the Federal Republic of Nigeria, which is a great stance to have. So this bill seeks to curb the alarming mortality rates and the avoidable hardship posed by the disorder, which is amazing. So the existing programs to enhance sickle cell disease control, I want to talk about that a little bit, just share where we are. So the World Health Organization came up with a strategy for sickle cell disease with the Regional Committee of 60 member countries. So there were 3 targets that were created in this strategy document in view of 2020. The number 1 was the member states with high sickle cell prevalence have developed implementing a clearly designed national sickle cell disease control program within the context of National Health Strategic Plan. So Nigeria's guidelines was completed in 2014 and has been in the implementation process since then. Another target was 25% of the countries in the African region should have adopted the concept of comprehensive healthcare management in sickle cell disease. So Nigeria, our emergency care for sickle cell disease is effective, and I'm a true testament to that. However, there's financial constraints that are a problem, along with outpatient care. A final target was at least 50% of all sickle cell countries would have established a sickle cell disease prevalence system with adequate trained staff. Information on diagnosis, treatment, and healthcare access for people with sickle cell disease in Nigeria has not successfully been done nationwide. Nigeria's current sickle cell disease statistics are over 25 years old, which is the whole 150,000 babies are born every year in Nigeria with sickle cell, which is a little bit outdated, and we should. So the strategies that I think we should add to the bill to scale the control of to scale control programs across the nation include increasing the provision of government healthcare facilities dedicated to regular clinical assessments of sickle cell disease patients in a steady state at outpatient clinics. Outpatient care should equally be as important as the care that I get when I am sick. NHIS plans should also improve their affordability for sickle cell disease diagnostics, including full blood count, malaria, and other infections. Also enforce genetic tests as a part of data collected for national identification, just like how we are expected to know what our is. We should also know what our blood type is, our genotype is. Free genotype testing should also be included in our immunization schedule. Then this bill should also recognize newborn screenings as a priority for sickle cell disease. Newborn screenings is crucial to also developing our database on sickle cell. Then finally, partnerships to facilitate sickle cell disease education materials within the educational system, so schools, universities, which will increase awareness and encourage screening among the youth and members of community. So these are the few strategies that really help with everything that we've already done. And yes, that's the end of my presentation.
All right, Sharon, thank you very much for what you had on there. Hi, everyone. If you have any questions, please have them noted, because after the individual presentations, we will have the Q&A session. Next will be to Toyin Adesola. She will be airing her own opinion as regards the issues surrounding the SCD Bill. Over to you, Toyin.
Yeah, thank you. Good afternoon, everybody. My name is Toyin Adesola, the Executive Director of SickleCell Advocacy and Management Initiative. I've been a warrior for 55 years. In fact, it's something that I'm always proud to say, so to break stigma on the issues surrounding the age limit of people with sickle cell. Now, concerning the bill, as Sharon said, is very laudable. I remember, I think last year or so, some parts of America, I don't think it's the whole of America, but a state in America has had a bill concerning sickle cell. And it's something that we've been trying to work on in this country. So it's very laudable that they have a bill to address the issues of sickle cell. But what I find is that it's one-sided. It's skewed towards genotype testing, prevention, and all that, rather than focusing also on the holistic aspect of the therapeutic and curative approach of sickle cell. Because let's face it, there are people with sickle cell. We're not going to rid of people with sickle cell, and in as much as we want to eradicate it, we still have people with sickle cell. So what do we do with that? What are the policies surrounding such people that are created to help them? Because especially from the low income, low literate people, sickle cell is an issue. We still face the issue of it being seen as a spiritual issue. There's not much information among them. So we need to have a more focused, holistic approach to the bill rather than skewing it towards prevention. So I just want to outline some areas I think that need some adaptation. And that is one thing about registration of hospitals. Now, it's good to register hospitals, but one thing I always say, and from my experience with working with people with sickle cell, not everybody goes to hospitals, especially in the rural areas. They do a lot of self-care, shall I call it, or herbal medication and all that stuff. So how do we address those people who don't really go into hospitals on a regular basis? When they give birth, they use their traditional birth mothers. So where do those people fall in? Because definitely they will have children with sickle cell. And there are also those issues, the issues of children that are born out of wedlock. The couples who are not married. So how do they go into the hospitals to say that they want to register their child and all that? So there's so many issues surrounding it that we need to look at a more holistic approach to dealing with it. A part in section 321 states that to encourage and impress on members of the public not to restrict intending couples. That is one thing I realize, that you cannot restrict people. People say, okay, what about the rights of the child? But the rights of the people in general, everybody has a right to choice. The only thing is how informed are they for that choice. And again, there was the issue of bringing them to the hospital when they found out they have the genotype, that they are not compatible. They will advise them and not to go ahead. And then if they insist, there will be certain repercussions. Now, my challenge, as I said, is how many people go to the hospitals to get registered. So we're only looking at what I call a more informed or more knowledgeable side of the population, whether they are middle class, lower middle, and all that, who actually go to the hospitals. So that is an area that I think we should not restrict, but we should provide genotype accessibility, and not just the regular genotype, but HPLC, because we've seen situations where there's been wrong information concerning somebody's genotype, and they marry and they have a child with sickle cell, and they are lost and frustrated that they were not told that they had this genotype. So what do you do with those set of people? Are you going to restrict them to, because it definitely wasn't their fault? So we need to, even in the accreditation, we need to accredit labs and diagnostic centers that are going to provide this form of genotype test. And the only true genotype test that you can be accurate is HPLC, and we need to provide it in the rural areas, because it's not everyone that would even know about it, nor even go to the hospital to have a checkup on their genotype. Then concerning the area of people, if you marry, then we do not have, provide medical care to your children. Now, apart from that, that is stigma discrimination, because everybody has a right to be taken care of by their own country. The citizens have a right. So you shouldn't hold somebody to ransom for another issue that has been the fault of the person. It will be unfair and inhuman, and we are now stigmatizing against people with sickle cell that way, because I've seen situations where in trying to put these restrictions, you give people who don't understand better a mindset that people with sickle cell are less of, they are not worth anything. So I think it's very important that we focus on those areas. Let's face it, sickle cell is not the only genetic inherited disease or disorder or whatever health challenge. You have Down syndrome, you have cystic fibrosis. So there are so many. So are we going to be continuing putting restrictions on people because of a hereditary disorder? I don't think so. So I think we need to look at a more holistic approach. There should be newborn screening. It's very, very important. We don't have any population like us. We should have, and we should realize it's just restricted to people with sickle cell, but it can help in so many areas in helping people know that whether the child is blind at birth and so many other things. So it's important that we have this from 0 to 28 days old. We should have this in place. I know there has been attempts by private and even government to try and put this in place, but for some reason it has never worked out. But I think it's something we look into, so that as soon as the child is born, there can be processes and management processes that can be used on the child and help the child live better at a young age, because you know that they say that most of them die below the age of before the age of 5. So it's very important that we try and help them grow. What I tell people, like, sickle cell is not a death sentence. Have adequate care. I told somebody once, if it's not because of our healthcare system in this country, we will not have so many issues. And the fact that people cannot afford best healthcare is also a challenge. So you see people from low income homes, as I said earlier, going alternate ways, which does not help, because these people they are going to are not informed in managing sickle cell. Then one thing I also wanted to suggest is that in terms of healthcare, there should be a support for federal medical centers, federal and state teaching hospitals and general hospitals in informing medical doctors on how to manage people with sickle cell, because that's the challenge we also face. So I think the policy should be more focused also on training personnel and bringing more awareness around. Then finally, I believe in terms of awareness, find ways to go into the rural areas where people cannot have access to the knowledge about sickle cell, to get them more informed in their own dialect, in their own understanding about knowing your genotype, about what having a child with sickle cell is, what it means and all that. Because I think if these are all done, apart from the preventive aspects of doing your genotype and providing free genotype to these people, I think it will go a long way in sorting the issue of sickle cell disorder. That's it.
All right. Yeah, you're doing. Thank you very much, Ms. Toyin Adesola. That was actually awesome. So moving on, we'll be having Dr. Alayo Sopekan, Deputy Director NCD at Federal Ministry of Health, to also his opinion as regards to what we're discussing here. So over to you, Dr. Alayo.
Good evening, ladies and gentlemen. Yeah, thank you for evening. Thank you for inviting me to be part of today's discussion, which mainly is borders on the Sickle Cell Bill pending at the National Assembly. Actually, the bill was proposed by former Governor of Enugu State, Sam Egu, and trying to see how we can improve on what we are doing for sickle cell disease in Nigeria, and see that we improve the quality of life of those who are already living with the disease. But of course, the bill came to us, and we looked at it, and just like the last speaker noted, there are a lot of areas there that we do not agree with, and principally for me as the National Desk Officer for Sickle Cell, and someone who has been in sickle cell space for almost 2 decades now. So I think there are areas there that we'll see that are not global best practice. And then 2, with the policy, the government policy on sickle cell, then also that we know it will also actually affect the rights of those living with the disease in the country. One of those things that where they say that people who are of the what you call a genotype, maybe C class, maybe they should not, maybe if you are AS, they should not be married, and all that. There should be a law or should ban them from getting married and all those things. That is morally wrong. It is ethically wrong, and we are saying that that is not is something that even globally is unacceptable. Yes, of course. All we just need to do, let people all the information they needed to have about sickle cell, and don't hide anything from them. Let them make sure they have true genotype testing, not the one they went and procure from somewhere, and at the end of the day, somebody will say, no, I am AA, or you are this or that. And at the end of the day, they have sickle cell, just like somebody last week I said, and at the end of the day, you have a child who is a sickler. That one. Then the other thing is that we don't want also to go through what is happening in a place like Lebanon and all those things. So, okay, maybe this group of people cannot marry this group of people. At the end of the day, they will emigrate to other parts of the world, maybe even to nearby countries, yeah, and get married and come back. You don't want to marry them. Of course, they can cross the border to Niger, Benin Republic, and then come back, and they have the children. And of course, they are citizens of Nigeria. And you stop them, you cannot. So, and another thing which she also mentioned is that we have a lot of single mothers now. We have a lot of them, and of course, they do know that before they start making love and start maybe taking decision that, okay, I want to start having sex, or I want to make love and all those, and then you get pregnant. Not that you say, oh, this man, before you can sleep with me, I want to know your genotype, So, and once and pregnancy comes in, and she decides that, no, I'm keeping this pregnancy and all that, and you don't know the genotype of the man that you slept with and all that, and the child turned out to be a sickler. So what do you do? So so these are the things. Then the other thing again is that we also look at it that it talked about aminosynthesis and all that, and that, okay, once you discover that this child is a sickler and all those, so you can actually, that such child or such pregnancy should be aborted. We're also saying that that is also not a best practice. The choice should be for the parents to decide, So, for instance, if you had some looking for children for years, and and then maybe they now got pregnant, and it happened that this child is having a SS genetic combination, will you ask them to abort it? No, they will not agree with you. That kind of thing, irrespective of the stress they might want to go through. And then again, we also know that science has actually improved the management of sickle cell cases, and which is the such thing. We have a lot of innovative drugs now coming up. Advocacy is available in Nigeria, which actually reduces a lot of the crisis that these children do have. That once they are placed on this hydroxyurea early in life, they can live their life like every other child, So then the other thing is that once we are able to identify these children in life, so I think we can do a lot to save their life, to make sure they live beyond the age of 5 years, and also achieve their dream like every other children. Of course, we've had many sicklers who have lived above 60, even 70, and we've had a lot of them who are in high places, of course. So, and again, we're also looking at it that the bill actually also tried to promote stigma, which is something that we are not happy about. It promotes stigmatization of those living with the disease, and that's another. And then overall, the major issue that I thought the bill would have addressed, which is funding exclusion for sickle cell, and see how we can mobilize funds to make sure that control in Nigeria is adequately funded. The bill did not mention anything about that. And we are saying that if the bill is going to pass, we've had several bills in the past. In fact, including the one that even said that we wanted to have a special commission for sickle cell disease, which we said that, okay, if we have a special commission, it means that we're going to start having commissions for our agency for all diseases in Nigeria. We think it's not cost effective. It doesn't make sense, So, and like this one too, and those are the areas that we are not happy about, because it doesn't provide how the disease control, the SCD control in Nigeria will be funded. You are not saying that, okay, maybe this is how it should be funded, because the problem we're actually having is not even all this, because, and from the past presenters, I noticed that there is a lot of information that they don't really have, what do I call it, information. There are a lot of information gap, maybe from what government is doing and what they are aware of. For instance, of course, there's a policy on NCD, which include that of sickle cell disease itself. We have a guideline produced since 2011, not 2014. Okay, it was produced in 2017, and it's a guideline that also have been reviewed by 2016, which is after 5 years, because it's written on that guideline. But then, because there was no fund, and efforts have been made to ensure that government funded it, put a budget for it and all those things, but then each time they remove it, that kind of thing. So we need to review the guideline, because there are a lot of new things that have come in that we need to put inside the guideline. And then also, she also mentioned, of course, we started integrating NCD services into the services at the primary healthcare level, because we are not even looking at the tertiary level of care now, because that is what we have done in the past and it didn't work well for us. We want to start from the primary healthcare level. Like somebody said the other time, that not everybody go to hospital. Of course, the reason is simply because one we have identified is the attitude of doctors in the higher level of care, and that was because they are overwhelmed. They are let me say overwhelmed with work. And we said, okay, why don't we make our primary health care level function well the way they should? They can be able to help us identify, for instance, these children early when these children are delivered, and then we can quickly institute comprehensive health care, for them, preventive measures, place them on the required against pneumococcal and H influenza infection. And then we can also start doing a transcranial Doppler ultrasound for them and screen out those that are prone to have stroke, and make sure we prevent them, place them on hydroxyurea and prevent them from having stroke, So, and every other things that they need the same blood transfusions available in Nigeria. So these services are there. But then the funding for us to see that all these services are actually integrated fully into the primary healthcare level is not there. So these are the areas that we are having challenges, and we have also made effort to ensure that at least for sickle cell, let all the services for sickle cell be covered without any exemption. That okay, this one is not covered, this one is not covered, from newborn screening up, even if you need the skin grafting for leg ulcers and all those things, So those are the things that we are looking at that this bill should have addressed, not all these things. not sure there was a serious technical input into that bill. And we think that, for me, we think that the warriors, or the so-called warriors, and and other sickle cell group, they need to come together and make sure that they speak with one voice and talk about this. And I remember when we set up these 6 solar STD centers for the country, where we installed HPLC, that's for newborn screening, when we did the newborn screening policy, including the protocol. We set up these 6 centers. We did a lot of community mobilization. We started in Southeast. We moved to the Southwest, to the North, I think, yeah, we did for Northeast, Northwest. I think it's only South that we couldn't do before I left then, before I was moved out to another program, So, but all that done, after that, of course, they could not continue because the state government, they are not funding such activity. Our federal government seems not to have fund now to do all those things, community mobilization, awareness creation. A lot of advocacy has gone in and all that. And if you ask me, of the centers that we set up then, I think it's only 3 that I can say categorically that are actually screening seriously now. The one in Lagos is screening, which is in FMC Browne-Peter. The one in Kefi, which is in FMC Federal Medical Center, Kefi, they are screening. I think Gombe, and perhaps in Kebi. But no, okay, yeah, the one in Abakaliki, they are also screening, yes. So those 3, Abakaliki, Browne-Peter, Kefi, Kebi and Gombe were screening before, but then I think they said they had issue with their machine. And we even took time to even call all of them together and tell us what is your problem, and we call the MDs, they must fix this machine. But in the South, the machine that is in the South, FMC Nagua, up till now, they have not installed it, they've not done anything, they've not done a single screening since we gave them that machine in 2011. Okay, so, and when I came back and I discovered it was the same thing, I said, okay, maybe what we are going to do, we've written to them, is just because of this COVID, we want to relocate that machine from them. Maybe we'll relocate it to a state where they are really serious, or to another place where people really rivers or Akwa Ibom or Cross River. So, but definitely not Delta, because Delta State has they have an HPLC machine. They have one in that state. So, so these are the things. So for me, I think for the screening test also that somebody said is just the HPLC. No, it's not just the HPLC. We have other technology that are available now. We have isolation. Of course, HPLC is the gold standard, and actually it is reserved for confirmation. And then now we are also looking at the possibility of bringing in the point of care test, where, because we have technology now that we can actually screen a baby immediately. You are removing the baby from the mother. You can actually screen for the genotype of that child. And then, if it is positive, then you can now take a DB and send it to for HPLC for confirmation. So that is also available. It's in the policy, it's in the guideline. If you look at the guideline, it is there. So this the other thing is that, of course, we have not been able to really build the capacity of most of our healthcare workers, and the truth is that manage these cases based on their own experience. But of course, the guideline is there, it is available, it's online, it's available online. But like I said, it needs to be updated with the new things. Then of course, I think most of the time I've said this. And then the strategies for WHO. Of course, even WHO has not really prioritized sickle cell disease. That is the fact. Just like especially in the Afro region, just like other diseases, they've not really prioritized it, and these are the issues that we are talking about, and we also are talking to our partners, and we want the sickle cell warriors to come together. And remember, we set up, even when we set up those 6 centers, we set up a support group for all the centers. And I make sure they came together. We brought them together under one umbrella, which we call SickleCell Support Society of Nigeria. The SickleCell Support Society of Nigeria is there, is functioning very well. But unfortunately, the SickleCell Society of Nigeria has been hijacked by some of my colleagues or in academia and others. They are doing a lot of researches. They are doing all kinds of things. So it is my belief that the warriors need to come together. Let them be part of this SickleCell Support Society, so they can use that, because it's a body that is recognized by government, and they've been working closely with government, so that I mean, it's supposed to be a mouthpiece for them. So, but I hope it is my hope that they will look at that and platform to make progress with whatever they want. But actually, those are the major problem we have is just funding. That is resource mobilization. That is all. And that bill has not been able to address that. Rather, it's actually trying to stigmatize those living with the disease. You know, and remember, we have over 150,000 babies born to sickle cell in Nigeria. Also, 25% of our adult population, and that is something we did in 1990. 25% of our adults are carrying S gene as what do you call as carrier. You know, you are asymptomatic carriers. So, and these people will get married. They must marry, and we keep giving birth. Okay. So it's this, I'm sure, and we are proposing to do another survey now for NCD to include the sickle cell, so that we can also have this. But we believe that by the time we can have a newborn screening policy implemented, we can actually, surveillance will be much easier. So it means each child that is born in Nigeria will be screened. And that is why we are also looking at the possibility of point of care tests, so that even if this child is born in a village, you will bring that child for immunization. And when the child is brought for vaccination, we'll screen them. I think that's a good strategy. Even if the child, because in Nigeria, you know, children are born everywhere. It's only in the mosque that a child is not delivered. So, but once that child is delivered, they bring them for vaccination. And at the point of vaccination, we can use that. You know, we can quickly use that to screen them and know the genotype of those kind of children. And then, like for this thing, somebody talked about sickle cell club. We set up sickle cell club in many schools. You know, then when we set up those 6 zonal centers, we did a lot of things that time. But like I said, all these things require funding. Once funding is not there, there is nothing anyone can do. So thank you very much. I think I've also learned some few things from the 2 previous presenters. I know that, yes, it is not easy, and a lot of them have been doing a lot of things to create awareness about sickle cell in Nigeria, and talking to people, you know, in the country to see that we can do a lot for those that are living with this disease, and improve the quality of their life, and ensure that more of these children survive beyond the age of 5. And I can assure you we are doing that, because even the last NDHS survey clearly shows yes, we have Southwest has the highest burden of the sickle cell. If you go and look at the NDHS survey of 2018, which came out last year, so Southwest has the highest burden, followed by Northwest, then Northeast, North Central, Southeast. This list is South-South. But of course, sickle cell is everywhere in Nigeria. Thank you very much.
Thank you very much, Dr. Alayo. Still stay on the line, as we're going to be having questions from the audience soon. So we're going to be having Mr. Oluseyi Olabisi. He's the Executive Director, Nigeria, Olabisi or Oyebisi? Oyebisi, oh, sorry about that. He's the Executive Director, Nigeria Network of NGOs. So Sir, you have the floor. You can go in now.
Yes, thank you very much for having me. And I'm glad that we're having this conversation again. I have listened to presentations by all of the speakers, and I must appreciate the fact that we all agree that there's an opportunity here and that itself a good starting point. So first, we must appreciate whoever developed that bill. We do agree that it lacked a lot of science and sociology of warriors. But having said that, we want to be happy about the intention. And in framing that is to also say that whoever developed that bill would first start by developing a bill. What are those who are able to see that product should now have all of the elements that are missing. So we want to approach it from this sense of, thank you, Senator Sam, or whoever developed it for this, but these are the missing links. And we want to do it in a way that ensures that we can stay as allies. So he's an important ally. And when you look at his profile, also being a former governor and now a senator, that he can influence that. So when talking or when approaching this, I want to start with that foundation so that we see him as an ally and we find a way of cultivating him in such a way that he has all the understanding about the issues that warriors face. He has all of the economic analysis in terms of what warriors are facing. Then he's able to use that in his debate. He's also able to use that to ensure that that bill gets passed based on the knowledge that we are supplying him. So we've been talking to ourselves. It's important now that we now talk to the policymakers. And in talking to the policymakers, two strands of things are very important. One is for you to understand that there's the politics of a bill and there are the technicalities of a bill. When I say the politics of a bill is, as a senator, I want to sponsor as many bills as possible. And I want to be seen as someone that is proactive in the National Assembly. All right, the kind of bill that I saw that sometimes do not matter. But you would see that the bill that has been sponsored, sickle cell disease, might have come from a personal experience of whoever sponsored it. So you have to also take that into your planning and also your strategies. The technical side is where you come in. So when I was trying to register for this, I see Dr. SickleCell, I see Sami, I see a couple of other SickleCell. I went through your website and said to myself, you have the technical side of what needs to happen. Okay. Now, the last speaker spoke about the civil society, the Sickle Cell Support Society. Now, and he mentioned that has been hijacked. Again, I'm helping you to tease the political and the technical, all right? Now, the society itself is your political. Whether government recognizes it or not, how you use your technical to influence the bill is what matters. We only have 19 or 20 of you in this room. This is the 20 that can influence that technical, all right? The political, the society can come against that bill, provided you are able to give the technical, and the technical starts from what are the issues of warriors? How are you documenting those issues in a language that an ordinary man of the street understands and that a Senate of the Federal Republic can pick up and say, no, 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 we need to fight and get this sorted before the next 2 3 years. So this is where we need the likes of Dr. SickleCell, Sami, and all of you in the show to focus on the technical. The society, let it continue to be hijacked. But what sense can you get from that society? He mentioned that they are doing research. Can you curate information from that research and see how it can help you to strengthen technical around that bill? Okay, now within yourselves also, as this group of 20 or group of 30, there would also be politics, the politics of your brand, the politics of resources, the politics of who is saying what, the politics of who is not saying what. But then, that politics should not be cloud that figure, 25% of adult population as asymptomatic carriers. Yet, that 25% must get married, all right? And get married, if care is not taken, if we cannot get them tested and we know their genotype at the point of delivery, then your work as Dr. Sammy or Sammy, whatever, doesn't make any sense. So fight amongst yourself, please. All right? But then ensure that you get the result. Because in the end, my son would also have to marry. Okay? And the work now is not for you alone now, but it's also for your children, for grandchildren, for great-grandchildren. All right? So the technicality is what I want you to focus on. And in focusing on the technicality, how can you bring knowledge from all of your experiences, one as individuals, for those who are warriors, and two, for those who have warrior-involving organizations. When I say warrior-involving organizations, is I'm a warrior, I've set up a non-profit. What are we saying from the work we're doing? And what exactly are the warriors themselves? The realities we're seeing from the warriors. So your warriors have a lot to tell you. When they bring their complaints, how can you frame their complaints into something that affects policy design and shapes policy, and even shapes your own implement programs and initiatives for that? All right. So please do a consultation amongst all the warriors. Let there be a report that says the voices of warriors on the bill. Then do something that looks like the two of you, like a technical analysis of that bill. And the technical analysis is complex. Read each of the clauses and interpret it as a layman, what it means to you as a layman. Then come up with thoughts about what should not fly. For instance, I was reading that bill, and the bill says that when you get to an hospital, you are tested, and you are AS or whatever, and you go ahead to marry, that child will be denied treatment. That zone is against everything the Constitution of the Nigeria Federal Republic believes in. That, again, is against a couple of treaties and international protocols that the federal government has signed on to. All right? But we need that technical analysis in ways that you can then present it as a parliamentary brief, 1 page, 2 page, that is sent to the sponsor of that bill to say, we appreciate this bill, but these are we have identified, and we are also happy to meet with you to explain some of these thoughts, the way we've seen them. And from experience, when you meet with him, he will tell you it is your bill. Propose changes. And I'm happy to accommodate those changes. Okay. So it's now for you to be able to also do that technical work, not the politics. All right, and be able to bring few people who can help you out that technical language that every other senator can, be interested in supporting him to pass, because it's going to go through a lot of phases. Once it leaves the Senate, it goes to the House of Reps, and once they get to the House of Reps, they also start their debate and all of that on it. Then they concur. Both of them agree whether it should be passed or not. If it is approved, then it goes to reading, goes to this to the president for assent. But you have a moment now. The moment you have now is that someone is interested in sponsoring a bill. That's the best opportunity. How you now use the next 2 years to get that bill up to presidential assent stage depends on the 20 or 30 I'm looking at in this room, not on the society. Right? Because again, the society itself is facing its own issues. Yes, they might also have interest in it, but they might not focus on it 100%. You focus on it because you seem to be on the ground. You have different organizational brand. What is pulling you together is different, and you are more on the ground to be able to provide the necessary feedback for this policy to be reviewed and passed eventually. So for me, a policy has to affect your livelihood. So think through that livelihood that you think this should be affected. Fund would be a problem. So don't come with the attitude that funding is what the problem is. No. We all have funding problem all over the world. For each policy, there's a funding problem. But let's look at it as what can a law, a section of the law, how can it enable the livelihood of warriors? And how can it, again, enable the work that we do as nonprofits around this? I'm happy that you're able to bring in the NCD focal point. This is very important for your work also. You're able to learn and glean some wisdom from the work of NCD. What are their challenges aside funding? What issues are they also seeing on the ground? And how can you use those issues to again advocate to the senator that has, sponsored that bill? This is very important. And he also mentioned something, that there's a guideline, a sickle cell management guideline that is online. And he said that guideline needs to be updated. Can this look at that guideline, get it updated, and use that tips in that guideline also to reform and review this bill? Okay, so because in reviewing that guideline, usually someone is waiting for a donor to sponsor the review of that guideline, a workshop and all. No. The technicalities of that lies in this room. Get that document, review it, look at what needs to change, what doesn't need to change, propose it in that guideline. You can even have a virtual session where you do a validation workshop with the ministry. And we'll look at it and say, yeah, this makes sense for now. Then it's approved by the highest arm, depending on what the process of agreeing on that guideline looks like. But initiate that process now. Again, this is where your value comes in providing that technical. Always run away from the politics, but keep to the technical. In the end, the technical gives you the platform for the politics, because when you're talking, you're not just talking for the politics of resources, you're talking for the politics of the issues. And the politics of the issues means that you have the evidence to guide what you say. You're not now talking sentimentally, no, you're talking based on evidence. That guideline also has to be reviewed, and it lies heavily on the group of 20 or 30 on this webinar today. You have all your organizations spread across the country. The first speaker was talking from Abuja. So you can already rely on our resources for you to get something done. She said she wrote to the minister, so she already understands what it means to write to a representative. Write on that strength and get a lot of things done. So you don't have to fly to Abuja, for instance, to get stuff done. She is in Abuja. Rely on our resources, rely on our expertise, and get what needs to be done, get it done. The NCD president also, I'm sorry, I'm going back to the NCD president a lot, because he has given us a lot of wisdom on how things need to change. He has told us that the World Health Organization is not also prioritizing SCD within its NCD program or initiative. That's also an advocacy strand, because once the World Health Organization prioritizes it strongly, then it means that they can already begin to look at national laws and policies and initiatives that can help achieve their own mandate, and in the end, help the warriors become better. So we need to also look at that. So I've mentioned 3 strands of work that this group needs to focus on. One is on that bill, providing a technical analysis and also engaging with the sponsor of that bill. The second is on the guideline for management of SCD. Sammy runs a hospital, so Sammy must already have some experience as to what should change. Dr. SickleCell, consciously assuming, must also have that experience of what should change. The first speaker must also have the experience of what should change in that guideline. Can we look at that guideline dispassionately, focus on 1 week, 2 weeks energy of work on it, and provide what needs to change? The third is the advocacy to the World Health Organization to prioritize SCD within its work, especially given the statistics that we just heard. And that statistics was only in 1990, I'm told. The population of, from what we heard, the population of Nigeria from up now has increased. So probably you're looking at a 50% of the population now carrying the health, what's it called? Together, so there's a need for us to quickly work around this, because again, when I look at it, I've seen many of my friends who are, and also, who are female, saying they are AS, and that because they are AS, they have to wait till they get AA. So AA is now something you go and trade on the Forex market, just kidding, all right? And this is a national problem, okay? And you have the moment and the platform now for you to be able to help us get this done, because if it's not taken in the next few years, the AA guys would be feeling big, and they will now start, using, because I'm AA, I need to do X, Y, Z, but that's just on a lighter note. But it goes to the need for us, again, to see how the work we're doing now affects a lot that's going forward. I also need to talk about the diversity of the civil society sector and to bring a sense as to the sickle cell support society. While you might, as an organization, decide to join or not join, you must be able to look at how can we use this society to achieve X, Y, Z. All right. So it's like thinking as a mafia now, in quote. I don't like these people. I like these people. But how do I use them to achieve what I need to achieve? Do we need to join them? If we are joining them, are we joining them for the purposes of just numbers and saying, as a society, we are sending this technical analysis, or what? You need to think of the politics of that society and the technicalities you're bringing, then also get into that politics of this is the message, this is what we want you to do, you push it. If it's not happening there, it can happen elsewhere. Nobody says you can't start a technical work group, all right? That will be national in focus, that would have its diversity and be able to focus on that technical work that needs to happen. So you need to think through that also. I am a yes, based on test results from a lab. Okay, and I go to the next lab, they're even telling me I'm not even A, I'm not AS, I am CC. You get my sense. So this area also has to be focused on, and we need to get, I'm not sure whether diagnosis is the right word, but we need to get it right, so that we're not saying someone that is AA is AS, or someone that is SS is SC, or someone that is SC is. This is an area that you also need to help us tease out as a group. You are on the ground to understand where the tests are. In fact, you can even start a naming and shaming of labs that are not doing it right, or create a technical guide for us. For those of us that do not say a technical guide, when you are going for your genotype test, this is what should happen, this is what should not happen, this is what the test should look like, this is how to technically know whether this is right or this is wrong. You know, I recently have an experience where, you know, my son went for his genotype, and at the point they were doing, the generator went off. All right. So when the test came out, he'd done this test already in a national hospital, and you know, the genotype was given to him. You know, so I decided not to mention the genotype because of data protection. He didn't allow me to mention it, so I won't mention it. You know. So, but again, because data protection is also part of what you do, and that also has to go into that. So he now needed to do it again. I don't know why the doctor just felt he should do that again. So he did it again, and it was said to be another genotype. Then when they finally come back with their generator and everything, they did it again, and I was told he's another genotype. 2 different genotypes in one person. And I was worried. I was worried because, you know, I had a second one who was also misdiagnosed because the labs weren't working well. And eventually I lost that young man or girl. I lost him or her in 1 month. So you need to focus on that also. And this group, a lot relies on you because you are the ones that have registered with the Corporate Affairs Commission to say, we want to work on issues around SCD. And you have the mandate to do that. And your various vision and mission says that is what you will do. You must account for that by ensuring that, 1, that bill gets passed. And when it is passed, it speaks reality of your constituency or your beneficiaries, which would be the over 150,000 or 200,000 or 300,000 sickle cell warriors that we have. The other is to also ensure that the management of the disease itself in Nigeria is in line with realities that you are seeing every day. That responsibility is on you. The third is to ensure that the global strategy for this to be done. Okay, I'm seeing that someone says that the strategy has been reviewed already by the University of Abuja. New suggestions have been sent, and the deadline target was 2020. Please look at that WHO strategy again. See whether it fits into the realities you are seeing in your various clinics, your work, and also your lives for those who are warriors. And the fourth is to ensure that whether you like it or not, you must face the issue of misdiagnosis, if that is the right word. Ensure that you name and shame labs that are not doing it well. And there has to be consequences, some way, somehow. I thank you for the opportunity to speak to you.
Thank you very much, Mr. Oluseyi. Really nice hearing from you, and your presentation was quite insightful. So I would leave the floor now to Maureen, who would be reading from the chat as regards other opinions stated by the panelists. And audience, thank you very much for tuning in. If you have any questions, please, the floor is open. Drop your questions in the comment box, and Maureen will read it out. So over to you, Maureen.
Okay. Thank you once again for everyone. The first, there's a comment there from Sharon. She says the WHO strategy document has been reviewed already by the University of Abuja, Nigeria. Suggestions have been sent as the deadline target was 2020. So Sharon, can you tell us more about this?
Okay, hi. I don't know if Nodu Obialigi. She is, so she's a lecturer at the University of Abuja, and she's also very prominent in this, sickle cell advancement space. She's involved in many organizations, so she's a very close supporter of mine, and she had let me know, because I had questions about WHO and their support. So her main focus is on newborn screenings. She has already she's already spoken with stakeholders to create new strategies for WHO to implement in their new targets for sickle cell disease in Africa. So she's already sent that out with her team. So I'll ask her again. Yeah, I'll ask her again for what exactly she has put inside the document.
Oh, okay. Okay.
I'm assuming
we'd like to have that when you have it available. You can share with other.
I'm assuming it surrounds newborn screening.
Okay. Okay. So yes, I know. I don't know her per se, but she happens to be my elder sister's doctor as well. She's a hematologist, and she's a global sickle cell expert, so to say. And that's nice. But the thing is, we don't get to see some of these documents. We just hear they do a lot of research, they do a lot of things, they've been to this place, to that place. We don't get to see anything. They don't carry others along. We know that some of us are maybe really small, NGOs, but perhaps if they look, into what some of us are doing, they will see the impact, the impact we're trying to create, and perhaps they could, allow us, let us in on what they do.
That's the thing. It took me. The thing is, when I started, I was so eager to find out what is actually happening, because I knew for a fact you can't find much online. So I would find people's emails, I would find people's names, I would go through strategy documents, see whose names are there, reach out to them. Like it takes literally almost stalking these people to actually find out what is going on. And some of them don't reply, some of them do reply after like 2 or 3 emails, but it really does take us bombarding them, literally, because if you talk to if you message them once, they won't take us seriously, especially because we are not, there's so many sickle cell NGOs around that we don't even seem like we're in unison, and that unity is very, very important.
Can I quickly can I quickly come in there?
Go ahead.
As for the strategic document that she said was reviewed, it's not a strategic document. The strategic document for sickle cell in Africa is the same. Like I said, it's still available online. What Professor Nodu was asked to do, because she's my friend, we work closely together. And I think there is one she's doing now with some others within FCT and Abuja. So what WHO actually what do you call it, took her as a consultant to actually go around some African countries, look at their cell program and what they are doing, and see how, what do you call it, do like a desk review of what these countries are doing for sickle cell, and see what best practices that can be adopted and that other countries can actually take in from others. And I can tell you that when that report came out, it shows that Nigeria is up there. We are doing so much, you know, more than any other country. The countries that actually come near us is maybe Kenya and then maybe Ghana here, you know, that kind of thing. But a lot of things we've done, a lot of things that we are doing that are on record, that none of them have even done that. You know, it's not this because they want to know from the strategies according to the agreement by the member countries and head of states, what of all these strategies, which one have you been able to implement in your country? You know, so she was employed as a consultant to quickly go around these African countries and come up with a report. I think the report is even with us. She shared it with us. So and we saw it, and that is the. But the strategy is there. Like I said, it's available online. You can Google it. You'll see it, and then you see the WHO Afro strategies. And don't forget also, you know, in 2011, when United Nations General Assembly on sickle cell, you know, we talk about sickle cell, Nigeria was there because we had the highest burden in the whole world. Of course, we made a very strong case for sickle cell, and based on that, of course, you know, there has been a lot of issues before that, before even WHO recognized, and UN, sorry, recognized sickle cell as a disease important that countries just have to do something about it, you know. So that is that, and based on that, of course, you know, we have been trying to be in the forefront to make sure that, yes, so, but the strategy document is available online. It is. But if it is the report that what Dr. Nodu did, that one too is available. If you want that, I can share that with you.
Because that I read through the strategy document online. It's just the reports that I was talking about.
Okay, so maybe we'll get it later and we'll get it across to everybody who's interested in it. And okay, so like I earlier said that some of these things we don't get to see them, they are not readily available. For example, this SCD bill, we just heard about it all of a sudden. You know, like there's a hidden agenda about it. You know, I don't know why it keeps happening like that. It's not it doesn't involve all the stakeholders, and I think it should involve all the stakeholders. All we heard is that it has already passed reading, or is it the second reading, and getting a copy of it, we had, as in, it was very difficult, very difficult. So I think sometimes, yeah, maybe Toyin has some more to say about this.
Yeah, it's, in fact, the way I heard it was so funny. My mother said, "Oh, I still have a bill." I said, "What bill?" So I now turned on television, and it was television that announced that the bill has already passed second reading. And to get the document, I had to go through people who had access to that level of, because it was hard, nobody could get it. So I think the challenge is that a lot of times things are done without involving the people who are really concerned in the matter. Which are healthcare practitioners, because even when you read the bill, you realize they were thinking from the, like Mr. Oluseyi said, they were not looking at the technical, they just looked at it with one view. A and A is equal to, I mean, 1 and 1 is equal to 2, rather than, okay, how does sickle cell really work? What are the causes? What are the, you know, because they just know that, okay, this comes as a result of genotype issues, forgetting that there are variations of the genetic issues that can bring about sickle cells. I think the challenge, as Maureen said, is for people who should be involved in such decision making and not being included, and it's something that needs to be reviewed.
So Maureen, can I comment?
Yes, sir, you can.
Yeah, you see, from experience, I think one is to say. So I want to be very careful how I frame this. Is to say that you won't always see bills, all right, especially when it is still at this stage. The crafting stage, the first reading, sometimes the bill hasn't even been prepared. It's just the name that is mentioned. At the second reading, maybe it's ready. It would have been ready, for members to see it and do some stuff of work, some kind of work and all of that on that. You don't get to see it as a public document until when it's public hearing. All right. So it is not that they have any okay. But if you are an organization that has been working with policymakers a lot and they see you as a knowledge, once they are thinking of even crafting it, they will send it to you for review before they present it on the floor of the House. So that is where your relationship also with policymakers becomes important. And you want to go to policymakers with an open mind, not with a mind of, are you hiding anything from us? All right. So you don't. All right. There's also the part where Sharon said something around they don't take us serious because we don't have a unified voice. We won't always have a unified voice. So it's always the power brokers' way of saying, you guys are not united, so we can't work with you. I've noticed that in my 15, 16 years of experience as a campaigner and as an advocate. So don't let that push you down. That's why I said focus on the technical. You can rush my work, or you can't tell me I don't have a voice or I need to be in unity if I give you technical analysis of the work you've done. You pay attention to me, especially when that analysis is very deep and you see sense. I give you a picture of what you've done right and what you've done wrong. All right? But I'm using the right framing and the right language for you. You pay attention to me. That much I've learned in my work. So if someone will tell you you are Nigeria network of NGOs, but you don't speak for all NGOs. Yes, I cannot speak for all NGOs. But what I've presented as a report, is it a reflection of the issues that all in the country face? Yes, it is. Do you get my sense? So your framing is very important, okay? And I like the way you've been chasing them. That's how we stalk them. Because sometimes they claim they are busy. Yes, they are busy, true. But those of us that they should involve or engage, they are not engaging us, okay? So stalk them as much as you can. Pick up the phone and call. You can go to their offices, go show up, but make sure that when you are showing up, you give value. So that I'm the one that will not start chasing you, not you chasing me. But by the time you come to my office and you say, I've reviewed this technical guideline, this is a 5-6 page report on that technical guideline. They are reading it and they are seeing sense. I'll be inviting you, not you chasing them anymore. Just thought I should mention that.
Thank you. Thank you very much, sir. Okay, so he says, I want to suggest that a central body profiles and map out the strengths and areas of proficiency of each organization working on the sickle cell issue, in order for us to have a formidable technical review team that will carry out the best work on arriving at the necessary amendments that needs to be done on the bill. Okay, Mr. Oluseyi agrees with Toby. So I hope we all agree with Toby too. I think he's right though. Or how do we get involved in doing this, in checking, carrying out this mapping out of, finding out each NGO's strengths and getting everybody.
Can I come
yes.
Here? Yeah, I quite agree with what he said, but I would suggest we have an external, well, I call it an external organization, not within us, to do the mapping. It's like you're outsourcing the job to somebody that doesn't have, how will I call it? Is it bias? What, I don't know how to frame it, but that doesn't really, but just is known to come and do a technical job and delivers the report, and then we have an idea, because if we evolve, there will be so much issues and all that. I feel we may not get the results as it should be, especially when you are trying to do things that have to do with statistics and data. I feel an external influence would help in arriving at a proper dynamics for such cases like this.
Okay, so this external body, would it be like another CSO entirely, or maybe like the Federal Ministry of Health, or I don't know, what would you suggest?
Yeah, I said it doesn't have to be a government establishment or anything like that, or a CSO. If a CSO is involved in some type of analysis, that's fine. But what I just feel it has to be somebody who is the professional opinion on mapping, on data, and all those influences. That's okay. It doesn't have to be government. Just somebody who that is their line of work in trying to do all this.
Okay. Thank you for that.
Hello, Maureen.
Yes, I can hear you, sir.
Apologies for jumping in again. So I agree with what Toyin said about getting an external person to do this. And I think in terms of my commitment, so I don't just start talking to you. The Nigerian Network of NGOs should be able to support you with this. Let's just get this done for you. We'll do that for you. We'll do it. Yeah. Okay.
Thank you.
Thank you so much. So I guess we'll talk behind the scenes on how that should go on. Okay, so if you still have questions or comments, you can drop that in the comments in the chat box. We are just, I think we are right on time with this. That thing from all our speakers, from Sharon and Toyin Adesola, from Mr. Oyebisi and Dr. Sopekan. Any other thing you would like us to know? How you think we can come in and, work together as people, whether individuals living with sickle cell or CSOs working on a sickle cell project, how you think we can join hands to we work, this bill, kind of, I wouldn't say please everybody, but kind of sort of everybody is happy at the end of the day. Let me put it that way, so that everybody is happy at the end of the day. Those warriors, parents, stakeholders, everybody is happy. If there's anything we can do to ensure that this happens, so let us know.
Well, for me, like Mr. Oluseyi said, it's just, definitely we may not agree on different platforms, because I know we have issues with that. But I think once we remember the reason why we're doing what we're doing, it will help a lot. I was even going to even ask, I forgot her name, the lady from Sickle Life. Yes, it seems like it's a Nigerian thing, but there are issues that we're all facing. And I think this is from other people, wherever you are from, can also affect, especially in concerning WHO. If we all come together, not just as an African country with sickle cell, but even those with UK, those in US, I think it will go a long way to be able to let people know that there are certain people that are very vocal about these issues concerning sickle cell and want to create changes and policies all around, regardless of where you are from. And I think that's where it starts from.
Okay, thank you. I think you're talking about Dr. Enambankas, right?
Yes, yes. I forgot her name.
Yeah, I think she heard you.
Yeah, she is. That's why I was mentioning her, but I couldn't remember her name. So forgive me.
Yeah, I've been listening in, and it's actually quite surprising. You thinking about Ghana right now, we are having the same issues, bills being sent to Parliament without any of us seeing it, projects being done for years without any reports or publications about it. We are still quoting data from 10 years and 15 years ago. So it seems like the issues are the same. I've listened to what the speakers have said, and I think that together we can make a change. I was just wondering about what it sounds like a good plan, but then it would end up being like we are always chasing after the people who are sending in the bills and other things. Because, for example, in Ghana, this year we're going to commemorate Sickle Cell Awareness Month, and then someone says they've submitted a bill to Parliament to declare June Awareness Month. So September is not Sickle Cell Awareness Month, without any consultation with any other sickle cell NGO. And then that's what they've done. And so because of that, they were trying to block our funding. And this is something that we've heard because we were going to be funded by a black entity. But then we don't have access to the bill. So we can't start providing technical support and responding to it until much, much later. Understand? So it makes it a little difficult. Like, it makes sense, but then I feel like we'll always be behind them, and then they'll always do something, and then it's like we are responding to them. Is there a way to get ahead of this? Because for me, that's what I want to do. There are so many problems that I think we should take the lead on rather than wait for them. And because they have the links with the politicians, they are able to draft bills and send them in. But then I could also probably write something about testing for sickle cell, for example, but I may not be able to get it as far as they will. So it's like I have to wait for them to send it and then respond after, which for me, I think is not as effective as if I was the one sending it first. So I really don't know what you guys think about that.
So what do you guys think about that? What does everyone think about?
The reality is that African, like Mr. Oluseyi, is African politics and African legislation and all that is what it is. It's something that we will have to keep continuing pushing ourselves. I don't like it myself. I always hate it. Everybody knows me and government issues, because I hate this chasing. But that's unfortunately the reality we face, and we just have to find a way to work around it. Maybe when we are more than one person, and like I was listening to you earlier on about the people sharing the same goals and vision. Maybe we continue to seek those type of partnerships, and we'll be able to speak more about it, and people will hear us more. But for now, I'm sure Mr. Oluseyi will say something too. That is the reality, even any facet of policies and stuff, whatever area it is, you still have to keep chasing these people, because right now they don't feel that it's their necessity to be influencing, to getting in touch with you. So that's my view at the moment.
Also, thank you. I just wanted to mention something. Is that okay? So I also wanted to say that using the media is extremely important as well, and not just social media. I know that we've all used social media to the best of our capacity, especially 2020. Everywhere I'm seeing sickle cell. And like, so it's even overwhelming to an extent, but I'm really proud of us getting on social media and using that avenue to spread the message, spread awareness where we are now and everything. But we can't forget that we also have to make sure, like, get a bit technical about using websites, also, like, if anyone researches now sickle cell in Lagos, sickle cell in Abuja, sickle cell in Kano, it's very difficult to find information. And these are the things that we need to start thinking about as well. And also, creating different content in different ways, going on shows, creating TV shows, creating our own content, all these things that you see influencers doing. That is the thing. Those are the things that us as groups should be doing, online, on TV, on radio, also using new ways to share the information. I feel like people have heard the same thing over and over again, that it's kind of, when people say know your genotype, is entering one ear and out the other. So these are the things that we also need, like, we need media companies involved to tell us, how can we get this message across in a different way that will reach the markets? I mean, how can everyone know so much about HIV or so much about cancer? It's because they're not they're using different platforms to talk about the same topic. And that's something that us together should learn how to do. So
in answer to that, I would say that I think why a lot of people use social media is because it's a cheaper medium. You don't have to spend that money as much as traditional media. A lot of people look at that, because I know how many times we try and say, oh, bring money to come on air, pay for this airtime and all that. So a lot of people, or even putting in newspaper, you want your article in newspaper, they will chop half of the thing if it's free, unless you pay for a space yourself, which is another expense beyond the average NGO. It's only the bigger NGOs that can afford to even spend that money. So I think that is a challenge we face when it comes to traditional media.
One of the things I would say to that is, so there are ways to work around that. For example, I've gotten multiple free articles, free airtime on NTA and all of that, because it's not just money they're looking for, also numbers. If you, for example, on June 19th, I know that many of us were able to get free showings on TVs and TV and stuff, because that was our day. So that's our day to talk about it and everything. So I think once you're able to identify the number of people that are following you and use that to your advantage, it can help so much, especially if you want to have like a corporate sponsor. If you want to have a corporate sponsor, you talk to them, these are the numbers that are following me, this is the number. Like, there's so much. I know that it's very technical and everything. Yeah, I think it's possible. I think it's possible to get free
Thank
media.
you, Sharon. Thank you, Auntie Toyin. I think we'll try and explore all this soon. But before we take one last question from, one comment from Uzoma Dozie and one last question from Dr. Kalejai. I would like to ask, we've talked about something that kept coming up was the issue of data, which is something that could help us in building some of these policies we are trying to, create. I don't know. I know we've had in our organization, we've talked about it even as a coalition sometime, as in SickleCell Advocacy and Management Initiative. We talked about it, maybe going from house to house. We'll start from a street and see how much we can get, of people knowing their genotype and knowing those who have maybe sickle cell or sickle cell trait. And from there, we just start from somewhere and move it up. Is it something, I want to ask Dr. Alayo, is it something that if the NGOs come together to do, is it something that could help the Federal Ministry of Health or the federal government? Is it something we could do? Is it something that, I don't know, if it's something that will be allowed for us to do, although it will take a lot of, it will need a lot of manpower as well as finances, especially when we need to expand and go to far regions to do that, or to the urban areas, into the villages and all that. So is it something that can be encouraged if we decide to do it as CSOs?
The catch in that is the fact that based on what we have observed, and not just observation, even some studies that we did, majority of the CSOs or NGOs embarking on maybe awareness creation and all those things. In the process of saying that you are giving information to people, they actually give wrong information, They give out a lot of wrong, unverified information to people, to the extent that, it actually even sometimes kind of complicates our work, So that is where the problem is. You know, for me, I'm always, when it comes to the issue of sickle cell in Nigeria, because the truth is that I'm an authority in sickle cell issue in Nigeria, so I don't just talk anyhow. So I'm very careful in what I say. And I think everybody who is in sickle cell space knows about that. So the thing is that we encourage people who, if you want to do something like somebody was saying that, oh, it's difficult to get these people, to get them and all those things. I don't think so. It is not true. Not with sickle cell. As far as I'm concerned, once, if it is federal ministry, in fact, we even try to partner with other ministry, because we know that a lot of issues in sickle cell are not in health. Because that is what I want all of us to also realize, that it is not just the issue. I mean, the sickle cell issue is not just in health. There are other line ministries that are also important in addressing the issue of sickle cell in Nigeria. For instance, if how many of our sicklers or the warriors talk about the problem of getting married, having partners, having to have a family, set up a family, or even job, be in a job and sustain that job and keep the job for a long time? How many? Then the issue of stigma. Health is not going to resolve those things. Health is not going to address that. Okay. Then there are many other issues. School absenteeism. Children, they are not in school. They are in and out of school, you know. So education also has role to play. Minister of Education has a role to play. Do you have a special distance for them, special arrangement for such kind of children? You know, these are all the things that we talk about in our policy, and then also multi-sectoral action plan. In multi-sectoral action plan, everything has been clearly stated out there. The roles of the line ministry, all stakeholders, including civil society organizations, other NGOs, development partners, and all those things, you know. So that is why I said that that time that, you know, the issue still goes back to having the right information, you know, that about efforts that been made in the last, let me say, 2 decades, that government has, that's what we have been able to push government to do. And for your, in fact, at that time, we didn't fund all this thing through budgetary provision of the ministry, because, like I said, there was no budget coming, you know. What we did was to go through the office of the Senior Special Assistant to the President on the MDG, which is Mrs. Amina then. And we talked to her that, look, as government, this is our problem and all those. And she said, yes, so we mean funded. And I mean, we cannot perform magic. Of course, we can use our technical know-how, we can use our skill, we can use everything and all those things. But you see that you are not actually achieving so much. You know, the problem you set out to address, you see that the problem is still there and is even becoming more and more complex. We did that, and then she agreed to fund some of these things, and based on that, we were able to do all those things you see that we did. So any information that you need, or any of you need, whether you are a CSO, whether you are a CBOs and everything, as long as you are NGO, write to us, we'll provide it for you. So we'll give you the information that is available to us. So we'll let you know. And if you need our technical support, we'll give you. We are here to support you, because that is why that is the reason why we are engaged, you know. But what I keep saying, and I'll keep saying that, even was it this week when I was in the board meeting of Sickle Cell Foundation of Nigeria, I still told them this. They need to see how they can work with serious-minded CSOs in the sickle cell space. Otherwise, we'll keep going around in cycle. We keep going around in cycle and coming to the same spot, you know, that kind of a thing. So that is that, because like I said, they are even making my own job difficult. You are making my job difficult because it's like I'm not even receiving the support that I needed. I'm making a case for people that they are not even, I don't even know, you know. It pains me sometimes when I talk like this, and I keep telling people it's not because of anything like sickle cell. I don't have anybody in my family who is a warrior or anything, you know. So, but I mean, it is what I've committed my time to do. It is what was trusted to me when nobody even wanted to take up the challenge, but I decided to take it up, you know. So, and the being there has also helped me a lot, because even when I was doing my PhD, I run my PhD on sickle cell, you know, that kind of a thing. So that is it. It's what I've committed myself to do, and at any time, I'm always available. But what I'm saying is that let us be serious. Of course, we have a lot of you that are serious about this issue, but it goes beyond just talking. Do you talk where people will listen? So that is where the point is. Or do you talk to people that will listen? You know, that's where the point also is. For instance, if I'm going to review a strategic document, like I said, reviewing a strategic document takes a lot, because it's a document that you say, for instance, if it's a national document, it's not just for use in Nigeria. For instance, if I go for international meeting, maybe I go to the World Health Assembly in Geneva, I can hold that document up, that this is the strategic document of my country, and people will look at it. They will look at the information there. They can make use of it, you know. So it's not just say, oh, maybe one or two of us will sit down somewhere and not do it, because it has to be a document that is acceptable, that is presentable, and that is verifiable and evidence-based, you know, that kind of a thing. So those are the things that government can say, yes, this is our position, this is what we are doing, you know, that kind of a thing. So those are the things. But I can assure you, for me, as somebody who is sitting on that desk, yes, even I can tell you that when I left in 2013, I left for National TB program, the sickle cell desk virtually disappeared in the ministry, because nobody was even willing to take it up. So I had to come back, I had to go back and talk to the PAMSEC myself, that I mean, all the effort we have put in all these things, the centers were not doing anything, and I mean, we are not seeing any progress, that please, I want to go back to that desk. And he said, okay, no problem, I want to go back there. Yes. And I was brought back again in 2016. So, and that is it. And even from 2016 to now, we have also made a lot of progress. Like now, there is this joint Federal Executive Council memo that we are pushing, that between the Ministry of Health and Federal Ministry of Women Affairs, to see how we can actually push the sickle cell disease agenda forward in Nigeria. You know, so these are the things that government is doing, or we are doing at government level. But the truth is that we also need the support of the civil society organizations, the support of you know, all the partners, those who are serious-minded, not just that maybe you are just talking, or you are there saying that you have this number of people and all those things. But I don't have any problem with that. But what I want is that let everybody come together as one. Then when we get what we want, then you can go back to your various what do I call it? Various organizations and continue the way you want. But when it comes to say, okay, we need this from government, because that is for us. I'm just telling you, because government, this is how we work. Once you can present a common front that this is what we want. For instance, we have a lot of strategies adapted from WHO and other things that we are doing. Yes, look at our strategic document, look at our policy, look at a protocol. Which of them we are not doing? Then you can challenge government. You can tell government that, look, this is not our document, this is your document. This is the plan that you have for. But we are not seeing any problem. We cannot even access this, we cannot do this, we cannot do that. So we want to know why. And then, of course, the Honorable Minister will know that, yes, it's been challenged here. And we have been telling him, and I think something serious can come out of that. Thank you.
Thank you, Dr. Alayo. That was very insightful. And from now on, I'm going to say we'll start disturbing you for information, documents, and the likes. So I don't know, is she still here? She has left. That was Dr. Kalejai. She had a question she wanted to ask you, but I think she maybe network or something. She was asking about other ways individuals can have genotypes tested in the meantime, since the proposed bill about newborn screening is still being discussed. Yeah. Okay, she's coming back in. I'll let her elaborate on this. Uzoma, I see you. He's suggesting that we discuss this bill in our various states' House of Assembly. So, Dr. Kalejai, you can ask your question, ma. You can unmute yourself and ask your question.
Good afternoon, everyone. Can you hear me?
Yes.
Good afternoon, everyone. I'm Dr. Kalejai. I'm an adult physician and hematologist at Luth. I run the Adult Sickle Cell Clinic. And thank you very much for all you do. Now, I realize that a lot of emphasis has been made on the newborn screening. But in the meantime, are there other ways by which you can get more individuals tested before that bill actually comes to pass? What other groups of people have been considered?
Yeah. Thank you, Dr. Kalejai. I think thank God you are an adult physician. You know, normally, there are various type of screening tests that can be used. Solubility test, even MP, all those things. And then the one that we are discouraging that now, because most of the time it is not really reliable, maybe because of the material that are being used or the person or human error. Some people that are reading it, because especially if it is not coming from a good lab. So, and because of that, we encourage people to actually use registered lab or very good lab, a certified lab, for instance, government hospitals, that kind of things, their lab. Then there is this one that we are trying to have an independent verification that we are doing, which is a point of care test. And the point of care test, of course, screening test can actually screen everybody, whether you are an adult or you are young, you are a child, or whether you are old or young, but is still undergoing our independent study to see that, yes, what they are claiming, but it is promising that, yes, it's something that we can use, that even in the rural facility, like primary healthcare center, once we build the capacity of people there to know how to carry out the screening test, they should be able to do it. And those ones that are positive, then we can now say, okay, if it is positive, then you can now go for, confirmatory test with HPLC or isoelectric focusing, which are also available in all big tools. So that is what we are trying to do as at now, as an individual. But of course, point of care screening test is being used by some people now, but of course it's not widespread, because there has not been a let me say, government pronouncement or policy on it. But that is one of the reasons also why we are trying to see that we review our national policy on sickle cell and the national guideline and the protocol also for screening for sickle cell in Nigeria. So we are trying to do that, but we want to make sure that we finish this independent, study on the claim of the two point of care screening tests that we have in country now. So I believe before the year runs out, we should be able to complete that, and then we can review our guideline, and then there will be a policy statement that yes, henceforth that will be the primary mode of screening test for everybody. And those one who are, and because it is even better for us, those who are not positive, to that will not necessarily need to go for confirmatory tests. It's only those who are positive. So, and it means the screening can be done by everybody. Even an individual can even do it. If you're educated enough, you can do it and read your results yourself.
I see.
Thank you.
Thank you. Do you mind if I say one more thing? I'm so sorry to take your time. So I did do an interview on World Sickle Cell Day. Just to, like to put more about sickle cell. Now, my thoughts about this advocacy, I think you actually need a few more stakeholders. I would think more about those that run preschools, those in the preschool age, the primary schools, secondary schools, university. So let me tell you what I think. So where can't have born testing, is it possible that we involve most of the proprietaresses of all these schools to make genotype testing part of the mandatory laboratory tests required by the schools? And when you miss it in you won't miss it in secondary.
Yes, you are.
University. And then one more thing, I'm so sorry.
Yes.
As part of pre-employment screening for those that are going to fall in love on the job.
Yes, madam. Dr. Kalejaye, I'm very sure if you are able to lay your hand on our multi-sectorial action plan for NCD, where you go and look at the portion for sickle cell, you'll see all these things there. In fact, we are even saying that before we can issue our international passport, that's Nigerian passport, okay? If you are asking me for my blood group, you are issuing me driver license, you say my blood group, you want to know my eyesight or all those things. So we should
Internet is fluctuating.
Also know, because for a country like ours, you also know what if you are going to go. Yes, hello, me.
I can hear you.
Yes, and then again, yes, and again, because newborn screening policy. In fact, that newborn policy, we can say targeted. When we say targeted, is for those, maybe the mother is AS or the father is AS, that is if you know. But what we are saying that because we know our environment, we don't even want to go through that, like we say, universal newborn screening. That's to say every child born in Nigeria, irrespective of where that child is born, that child must be screened. And that is why we are also looking at the possibility of bringing in this POCT. And once a child is born in an hospital, before that child even goes home, okay, before that child goes home, that child is screened and his or her genotype is recorded. And if the child is born somewhere else, like I said earlier, that is only in the mosque that conducted. So when the child, or in the Babalawo's place, but we know that those kind of is still them for vaccination.
Oh, yes.
They bring them for vaccination. Yes. So we are going to use that opportunity to screen them. So, and with that, every child will know his or her genotype as the child is growing up.
That's fantastic.
Thank you.
Very well done.
Thank you. Thank you very much.
So, hello, Maureen. Can I jump in? I need to quickly run now. My sincere apologies. But let me just quickly.
Please go ahead, sir.
Okay. So, thanks to Mr. Is it Mr. or Dr. Alayo? I got that right.
Doctor.
Okay, Dr. Sopekan. I think he has given you a lot of wisdom, and if I were any organization in this group, I would find a way of seeing whether we have data that can provide the kind of information that he has said that would be helpful for the kind of work he does. And he's also an ally, given the fact that he understands the issues, he's seen the policies, he understands what are. So it will be good that you also find a way of teasing out a lot of wisdom from him. The other part is also the need for all the organizations working on sickle cell to become aware of the guidelines and to raise awareness on the guidelines. I'm seeing that as a gap. So if you don't have access to the guideline, please ask him. But he said it's online. Ask him for all of the information. Create infographics about it. Let us, those of us that are not warriors, let us also know about that guideline. So that once I get into an hospital and a warrior is being treated wrongly, I know what to say based on that policy. So your work is that of awareness. Raise awareness a lot of about that policy. Again, look at the gaps. Like he has said, a technical review is an expert work. You have that, what's it called? You have the information. Read online on how to also do that, provide that expert feedback. There are a lot of toolkits on how to provide it. You would be able to pick up 1 or 2 or 3 things. Send it to people like him. He will do a review, come back to you and say, you've given us the right information. Not given us the right information. Use that also to build capacity along the way. But 3 key things I'm taking out of this: your role as awareness, your role as policy advocates, and also your role as implementers. Again, this is not going to be an easy task. It's not going to be easy, but you can do it, provided you stay focused on all of this. I won't start our state assembly. That will not be easy. But focus on the first. We have a bill, a proposal on the floor of the National Assembly. Focus on providing the needed information for that to be strengthened. 2, focus on educating all of us as citizens on SCD, on the guidelines, on the management. And 3, build your capacity to be able to engage with all stakeholders. Again, I thank you for the opportunity to be able to talk here, and I wish you all the best for the weekend.
Thank you very much, sir. All right, thank you. Thank you everyone for participating. Join us, continue the conversation. Tell us the insights you got from this, your high points. You know, use the hashtag Together We Can so we can find it. Tag at Sammy Updates, at Dr. SickleCell. Let's keep it going. It's still September Sickle Cell Awareness Month. Thank you, and Toyin, for being here. Thank you, Mr. Oluseyi. Thank you, Dr. Alayo. We really appreciate. Thank you, Sharon. It's really nice having you here. Thank you, Dr. Bankers, for staying through. I would now like to also thank our partners on this program, which are Dr. SickleCell Advocacy and Management Initiative, Sickle Life Ghana, African Film Consortium, Cells of a Generation, Fresh Cell Incorporated, WHO Africa. And this will be uploaded to our YouTube channels later on.
Thank you, Maureen. Thank you so much. It's a privilege to be part of this. I'm grateful. Thank you so much.
You're welcome, sir.
All right, Dr. Alayo. Thank you.
You're welcome, my brother. Thank you so much. And have a weekend.
All right, you too. Bye. Bye.